Thank you, Presiding Officer. From day one, we told the SNP that Humza Yousaf's NHS recovery plan would not help patients. That was back in 2021, and only now Humza Yousaf's big promises are finally in the bin. All these years have been wasted while patients suffered, and John Swinney insisted that everything was going great. He has now grandly announced all the same ideas that the SNP have already failed to deliver, but still with absolutely no credible explanation about how any of it will actually be achieved. So how can John Swinney expect anyone to believe that he will ever deliver his recycled promises?
First Minister.
President, at the start of the week I set out the Government's focus, which will be on three key areas: on ensuring the resources are used to have the greatest effect and impact on driving down waiting times and clearing treatment backlogs, on reform of the system to deliver the right care in the right place, and a long-term shift to prevention. And we will accomplish that by making sure that we provide the necessary policy direction, which I've just set out, and also the resources which will be included in the Government's budget with the biggest settlement for the health service. And I'm very pleased that we have parliamentary support for the budget, but it's well shown that the Conservatives are not part of the agreement to try to move the health service forward in any way, shape or form.
Russell Findlay.
I hope John Swinney heard what the BMA had to say about his speech, which was this. Dr Ian Kennedy of the BMA said, "We still lack the detail and comprehensive vision needed to make any plan a reality." In a classic case of government by press release, all that matters to John Swinney is an easy headline with no interest in the difficult job of delivery. So here's an example of that. 6 years ago, all NHS patients south of the border were given an app to access information. They can make appointments, order prescriptions, view medical records and more. 2 years later, in 2021, the SNP announced plans for a Scottish NHS app. But there is no app, and John Swinney has the audacity to announce it all over again. The SNP has kept Scotland's NHS trapped in the analogue age. So when exactly will Scottish patients get access to this vital technology?
First Minister.
What I set out on Monday, and what's been followed up in very regular engagements between me and the Health Secretary and health service leadership around the country, are the practical steps to improve the health service and to secure delivery. So, for example, we will be concentrating on steps such as the expansion of the NHS Scotland Pharmacy First service to improve access to health care, to ensure that we expand GP capacity within the country with a £10.5 million expansion of activity. We will deliver a new acute anterior eye condition service which will free up a combined 40,000 hospital appointments per year within Scotland. We will expand the capacity of hospital at home to create at least 2,000 beds by 2026. We will be expanding capacity at national treatment centres at a number of centres like Gartnavel, Inverclyde, Stracathro, Perth Royal Infirmary, Queen Margaret Hospital and also the Golden Jubilee Hospital in Clydebank, delivering extra cataract procedures. We will also be reducing the radiology backlog. So I hope that's maybe enough detail that will... Well, Presiding Officer, I'm very happy to go on, Presiding Officer.
I'm content that your response is complete, First Minister. But before I call Mr Findlay again, I would just remind members that the purpose of this session is scrutiny. And if we have ongoing noise in the chamber, all that's happening is fewer members are going to have an opportunity to put a question, and I would ask all members to bear that in mind. Russell Findlay.
Yeah, well, I mean, I wasn't making a single noise. I was just smiling in incredulity because I asked the First Minister about an app, and he went off and read from some different script. And, you know, the answer tells patients there is no idea when this app will ever appear, if it does. And that's not the only reheated promise John Swinney made this week. A decade ago, the SNP announced plans to create a network of national treatment centres. They were supposed to be all over the country. if Shona Robinson would care to listen. But here we are, Livingston, not open, Ayrshire, not open, Perth, not open, Lanarkshire, not open, Edinburgh, not open, and Aberdeen, not open. And now John Swinney is again making the same old promises to deliver national treatment centres. So can he please tell the truth to the thousands of Scottish patients who are waiting in agony? When will these actually open?
First Minister.
Presiding Officer, here's some truth for Parliament. Here's some truth for Parliament. In the years of austerity, under the Conservative government, the capital budgets of the devolved governments and the United Kingdom government were slashed. Why? Because of economic and fiscal incompetence by the Conservatives. That's what happened. And I am now going to deliver the National Treatment Centres. But what's certainly not helped me, what has not helped me has been Mr Findlay's support for the economics of the madhouse brought forward by Liz Truss, who he wanted me to follow. He wanted me to do exactly what Liz Truss had done. Thank goodness I never followed the stupid ideas of Liz Truss and Russell Findlay.
Russell Findlay.
I only asked the man when he's opening these treatment centres. But what we heard back is the populist party's disease of blaming someone else for their failings. The SNP government gets record funding and they're continuing to pick the pockets of taxpayers, and the state of the NHS in Scotland is entirely on that lot there. The SNP need to stop chasing headlines and start doing some hard work. We need a health secretary who's focused on the job. Projects in press releases need to be delivered, and taxpayers' money should be spent much more effectively. Right now, across Scotland's health service, over £850 million is being spent on communications, HR and other departments. That's almost £1 billion a year on backroom corporate functions, not frontline medical services. If the SNP attempted to cut this bloated bureaucracy and kept their countless promises, then waiting lists can come down. So wouldn't it be better to spend less money on back office staff and more money on doctors and nurses?